Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Chromosomal abnormalities as well as the syndrome which are associated with the brain tumors. So to begin with, the first syndrome is the neurofibromatosis. There is neurofibromatosis. So this is, we are looking at the type 1. So what is the gene defect here? So gene defect, we are writing it as GD. So what is the gene defect here? It is nothing but the neurofibromatin, neurofibromin, and this involves a chromosome 17q. Next is, we look at the tumors. The tumor, it includes the neurofibromas. So there is the neurofibromas, and there is also the malignant peripheral nerve sheath tumors. There is a malignant peripheral nerve sheath tumors. Next, there is also the hemarthromatous. There is hemarthromatous. There is hemarthromatous lesions as well as the pheochromocytomas. Next is the presence of the neurofibromatosis 2. So there is neurofibromatosis type 2. So here in type 2, there is a gene defect, that is presence of the schwannomin. So this is involving the chromosome 22. So it's a chromosome 22q. So what are the tumors involved here? The tumors involved here, it is the bilateral 8th nerve. There is a bilateral 8th nerve, and there is presence of schwannomas. There is also the multiple meningiomas which is present. Multiple meningioma. Next is the ependymomas of the spinal cord. So ependymomas of the SC, that is the spinal cord. Then we move on to the Cowden's disease. So here in Cowden's disease, it is involving the gene defect, that is a P10, that is a chromosome 10. So talking about the tumor, it is dysplastic cerebellar ganglioma. It is dysplastic. It is cerebellar gangliocytoma. And it includes the Lermite-Duclos disease. There is a Lermite-Duclos disease. And there is also the presence of the meningioma. So there is meningioma as well as the astrocytoma. Next, let's look at the VHL. So when you look at VHL, there is a VHL gene. So VHL gene, it includes the chromosome 3p. And what will be the tumor here? In VHL, the tumor is including the hemangioblastomas. So there's hemangioblastomas as well as the retinal angiomas. There is retinal angiomas. Next is the MEN1. So under MEN1, there is a menin. So menin is chromosome 11q. And what are the tumors? The tumors, it includes the pituitary adenoma. This pituitary adenoma. Next is the malignant and the schwannoma. Now let's move on to the Lee-Fromenil syndrome. So it's a Lee-Fraumeni syndrome. So here the gene defect is going to be P53, and it is nothing but the chromosome 17P. So this is associated with the gliomas as well as the medulloblastomas. To learn and grow daily like this, please do subscribe.